introduce myself. I'm Kelly. I'm going to be your nurse practitioner today, and I'm going to be performing a physical exam on your head, eyes, ears, nose, throat, cardio, respiratory, and peripheral vascular system today. Do you have any questions?
Nope.
Okay, can you start telling me your name?
Ian.
And your date of birth?
July 26th.
Okay, great. Okay, well, I'm going to start with your general inspection. You are dressed appropriately, no signs of distress noted, so we can get into the assessment, okay? I'm going to start with your skin. I'm going to be looking at your skin, looking for any erythema, lesions, masses. None of that is noted. Okay, take a look at your arm. Okay, looking for any lesions or masses. Okay, and I'm going to be checking your first skin turgor. Good, it went down easily. And check for your temperature. Your skin is warm, dry, and intact. Okay, now I'm going to move on to your fingernails. Pressing. Okay, your nail beds look pink. Capillary refill is less than 3, and no signs of clubbing noted. Okay, how are you feeling? Okay, is it okay if I move on to your head?
Yep.
Okay, I'm going to be inspecting your head. Looks good. I'm going to be, is it okay if I touch your hair?
Yeah.
I'm going to be checking in between your hair, your scalp for any lesions. Everything looks good. Your head is normal cephalic and atraumatic, which is really good. And now we're going to move on to your eyes, okay?
Okay.
Let me inspect your eyes. Your eyes look symmetric. Good. Let me look at your eyebrows. Your eyebrows are symmetric. There's no thinning noted. Your eyelashes look good. Your lacrimal glands have no signs of tearing or crusting, which is good. I'm going to check your conjunctiva. Can you open your eyes and look down? And I'm going to check your sclera. Okay, your conjunctiva is pink, no signs of redness or inflammation. Sclera is white with no signs of redness or inflammation. Let me check your lacrimal gland. Okay, looks good. And now I'm going to be doing a fundoscopic exam on you. So I'm going to turn the lights off, okay?
Okay.
Okay. Turn this on. I'm going to be putting the diopter at 0, and I'm going to have you look over my shoulder. And I'm going to go, oops, wrong side. And have you look over my shoulder at the wall over there. I'm going to come in shoulder to shoulder at a less than 15-degree angle to look at your optic disc. It looks pink, creamy, with sharp margins, no sign of papilledema, and the retina shows no signs of AV nicking or hemorrhage. And now we're going to do the other side. Okay, coming in, shoulder to shoulder. Okay, no signs of AV nicking or hemorrhage in your retina, no signs of papilledema, and your optic disc is creamy pink with sharp margins. Okay, great. Now I'm going to go turn the light back on. I'm done with the fundoscopic exam.
Okay.
Okay. Now I'm going to be testing your pupillary response. I'm going to shine the light and test for consensual and direct responses. Ready? Do you move this way? Okay. Okay, your eyes are consensual. I'm going to check this now. Okay, and now we're going to test for accommodation. I'm going to turn the light off. And I'm going to move this from your nose towards me and back and just focus on the object in front of you, okay? Okay, your pupils are dilating as you look as it goes away and constricting as it goes forward. Your pupils are equal, round, reactive, and reactive to light and accommodation. Good job. Okay, next I'm going to be checking the 6 cardinal gazes. And we're testing for nystagmus and strabismus. So I am going to have you look at me and get to your eye level, and I'm going to ask you to not move your head, and I'm going to move a finger in 6 directions and just to have you look at them, okay? Okay, great. No signs of nystagmus or strabismus noted. Now we are going to be doing the cover-uncover test. So I'm going to have you cover this eye, and I'm going to cover the same one. And then I'm going to test your peripheral vision. Let me know when you see the...
No.
Okay. Now let's do it on the opposite.
No.
Okay, great. Now we're going to be performing the static wiggle test, okay? I'm going to hold 2 fingers up and tell me which fingers I'm moving, okay?
Your high one
Yes?
and the low one.
Okay.
Both.
Okay, good. No peripheral vision loss. Great job. Okay, that concludes our eyes. And then we're going to be moving on to the ears now. And I'm going to start by inspecting your auricles, making sure your ears are symmetric. Let's move you a little bit closer. Okay, which they are. Great, no signs of sun damage, no lesions or erythema noted. And now I'm going to be palpating your mastoid. Any tenderness?
Nope.
Any tenderness at your tragus?
Nope.
I'm going to pull. Any tenderness?
Nope.
Okay, now let's move on to the other side. I was going to move you up a little forward. Okay, any tenderness when I touch your mastoid?
Nope.
The tragus?
Nope.
When I pull?
Nope.
Okay, now I'm going to be using the ophthalmoscope to look at your tympanic membrane. Because you're an adult, I'm going to be pulling your pinna up and back when I look in. I'm going to take a look. Okay, your tympanic membrane looks pearly gray. I'm able to visualize the ossicles, and your cone of light is at 7 o'clock. No signs of bulging, effusion, or perforation noted. Let's do it on the right side. I'm gonna move you a little closer. Pull it up and back. Oops. Okay, your tympanic membrane is pearly gray. No signs of bulging, effusion, or perforation. Your cone of light is at 5 o'clock, and we're able to visualize the ossicles and the malleus and incus. Any questions?
Nope.
Okay, great. We're going to move on to the nose. I'm going to have you switch forward a little bit. Okay, your nose looks symmetric. No signs of erythema, redness, lesions noted. Can you lift your head back for me, please? Your septum is midline. And now I'm going to be looking at your inside your nares, okay? Okay, your no polyps noted, and your turbinates are pink. Let me check the other side. No polyps noted, your turbinates are pink. No discharge noted either. And now we're going to be moving on to your mouth. Let's move you. I need to get the camera. Let's go this way. Okay. Now, let me look at your lips. Lips are pink, moist, no crusting lesions noted. Could you open your mouth? Your teeth, smile. Teeth look good, no signs of missing teeth or poor dentation, no signs of bleeding on your gums, and you're not inflamed at all. Now open your mouth. Okay. Buccal mucosa is pink. No signs of white exudate or lesions. Could you stick your tongue out for me, please? Your tongue is midline when sticking out. Cranial nerve 12 is intact. Can you lift your tongue up for me? Okay, underneath your tongue, no lesions. Redness, erythema, it's pink and moist. And your top of your tongue is pink and moist. Now I'm gonna be taking a tongue depressor. Sorry, I'm gonna move it back a little bit. I'm gonna ask you to say ah, okay? Stick your tongue out. Okay, great. Your uvular rise is midline. I'm able to visualize your tonsils, +1 bilaterally, no exudate, and your hard and soft palate is pink. Okay, great. So that concludes the throat portion of the exam. We're going to be moving on to the neck, okay? Okay, so let's see. Your neck is symmetric. No erythema lesions noted. Trachea is midline. I'm going to be testing your thyroid. I'm going to be palpating your thyroid. I'm going to move you forward like this. I'm going to be moving the sternocleidomastoid mastoid to the side. Okay. No goiter noted. Feels intact. Okay. And now we're going to be testing your jugular vein distension. So I'm going to ask you to sit at a 30-degree angle. I'm going to grab my things. I have a ruler over here. Where's my ruler? Okay. So, okay, I'm going to squat. Okay, I'm able to visualize your jugular vein. I'm going to be putting this here, and I'm testing the angle. Okay. Okay. And looking, yes, thank you. Look to the side. And good, you're less than 3 centimeters from the sternocleidomastoid. And that is great. Okay. Can you sit up for me again, please? And lastly, we're going to check your lymph nodes. So I'm going to have you sit over here. Can you open your legs up, please? And I'm going to be palpating your lymph nodes. Okay, I'm going to start with your preauricular, postauricular. Do it in this way. Occipital, submandibular, submental, tonsillar, anterior cervical, deep cervical, posterior cervical, and supraclavicular. Okay, great. Your lymph nodes are non-tender, mobile, and not inflamed. Okay, good. Now we finished the head portion of the exam. We're going to be moving on to the respiratory. So I'm going to start by inspecting your respiratory. Could you sit up for me? Okay, your AP diameter is 1 to 2. Your breathing looks good. No signs of retractions noted. Rate and depth are normal. I'm going to start by palpating. I'm going to palpate, and I'm going to have you go like this. I'm going to palpate 3 areas in the front. Okay, and now can you say 99?
99.
I'm testing for tactile phrematous.
99. 99.
Okay, no crepitus noted. Tactile phrematous equal bilaterally. No, I'm going to be palpating in the back in 4 locations. Okay, now I'm going to ask you to lean forward a little bit more. I'm going to ask you to say 99.
99. 99. 99. 99.
Okay, great. Now I'm going to be testing your chest expansion. Can you take a big deep breath in for me? Okay, chest expansion is symmetric. Now I'm going to be percussing, and I'm testing for any signs of resonance, hyperresonance, or dullness. What we want to see is resonance. So I'm going to start up here. 1, 2, 3, 4, 5, 6. Okay, resonant sounds throughout. Now, I'm going to be testing the back. Can you lean forward? 1, 2, 3, 4, 5, 6, 7. Okay, great. Now, before we move on to the next thing, we'll be testing your diaphragmatic expansion. Let me grab these. Okay, I have a pen over here too. Okay, so I'm going to be testing your diaphragmatic excursion. I'm going to ask you to take a big deep breath in and exhale fully. Okay. Okay, so we're gonna mark this down. Okay, and now I'm gonna have you take a big deep breath in, or take a couple breaths in between, and now exhale. Okay, now I'm gonna have you take a big deep breath in and exhale. I'm gonna be testing the percussion again. Okay, it's still here. So let's measure this. Let me mark this area. Okay. And let's see. Okay, between 3 and 5 centimeters, great. Now, before we move on, I'm going to auscultate your lungs. I'm going to do it in 7 areas on the back. Breathe in and out for me. And then I'm going to have you sit in the front. Or sorry, lean back like that. Yeah, I'm going to auscultate again. 1, 2, 3, 4, 5, 6. Okay, great. I am done with the respiratory portion of the exam. Do you have any questions before we move on? Okay, we're going to be doing the cardiovascular assessment now. First thing we're going to do is look at your carotid. So I'm going to ask you to tilt your head back a little bit to look at your carotid. Okay, looks good. I'm going to be auscultating with the bell of my stethoscope for a bruit. What's wrong with it? Okay. Okay, no whooshing sound or bruit noted. Next I'm going to be palpating, then do 1 at a time. Okay, +2. +2. Okay, great. Next I'm going to be inspecting your chest. If this was a real exam, you'd have your shirt off and we'd be checking for any trauma, deformities, flail chest, anything like that. None of that noted. And now I'm going to be, let me check the back. Okay. And now we're going to be, I'm going to be palpating. I'm going to be palpating for any thrills or lifts. I'm not noting any of that. I'm going to find the point of maximal impulse. Can you turn to the left a little bit? Turn your body to the left. Okay. Point of maximal impulse is felt. Next, I'm going to be auscultating your heart sounds. So I'm going to be checking for any murmurs and listening for S1 and S2 sounds. I'm going to be starting in the aortic area at the second intercostal space on the left with the bell of my stethoscope, and then the diaphragm. Now I'm moving to the pulmonic area, which is at the second intercostal space on the, the aortic is the second intercostal space on the right, and the pulmonic is the second intercostal space on the left. We'll be checking with the bell of our stethoscope, and then the diaphragm. And I'm going to be moving on to Erb's point, which is the third intercostal space on the left sternal border. Okay. And then we're going to be moving to the tricuspid area, which is the 4th to 5th intercostal space on the left sternal border. Okay, and then the mitral area, which is the 5th intercostal space at the mid-clavicular line. I'm using the bell of my stethoscope. And then I'm going to be using the diaphragm of my stethoscope. Now I'm going to ask you to lean back and then turn to the left. Turn your body to the left. Yeah, there you go. And I'm going to be testing for murmurs at the mitral area. Okay, now noted. And now I'm going to ask you to come back and lean forward. Take a big inhale and exhale. And I'm going to be checking for murmurs with the patient leaning forward. Let me go on the other side. With the patient leaning forward like so. Okay, you can sit back. Lastly, we're going to be performing the peripheral part of the exam. So I am going to be testing for your radial pulses. +2. Lift your hand up. +2. Now the brachial. +2. +2. Femoral, I'm going to hover my finger above your femoral area. Okay, now +2 bilaterally. I'm going to move you back. And I'm going to... Okay, now I'm going to test your popliteal. Bend your knee. Okay, +2. +2. I'm going to test your dorsal pedis. +2. +2. Okay, and then I'm going to ask you to take your socks off. And I'm going to be checking for any edema, varicose veins, coolness. Your skin is warm, no varicose veins, edema noted, no erythema. Everything looks normal. And I'm going to be testing the capillary refill of your toes. Less than 2. Okay, great. Do you have any questions before we end the exam?
Nope.
Okay, well, it was a pleasure working with you. I'm Kelly, like I said. If you have any other questions, let me know.